Hi everyone, how are you going? Are you enjoying the subject thus far? I really hope you are. All right, let's get cracking. We are going to be looking at joints now. Joints or articulations, how they're actually called. Articulations. So the word joint and articulation means exactly the same thing, just so you know. I'll get myself organised. Here we go. All right, so don't forget, you need to make sure that you answer all of your learning objectives in your own words as much as you can. Okay? You need to do that for your assessment tasks for this subject. I know I sound like a broken record. That's because I am. Okay, so we need to spend a little bit of time now thinking about joints. Joints allow movement, okay? And the definition of an articulation is the location where two or more bones meet. Okay? Now, I have spent a long time reading about this, and I can tell you now that even I was confused. Yes, I was very, very confused when I was reading about articulations in the textbook, in some textbooks. So I'm trying to teach you about articulations as simply as I possibly can, because it actually is quite simple. So there are two ways that we can classify joints. First of all, we can have a look at what the joint is made out of. And the other way is what is their job or how much they move. So that's concept number one. The joints can be classified on what is between the bones, and we can also classify them with regards to, this joint only moves a little bit, this joint doesn't move at all, and this joint moves kind of a little bit or a lot, okay? So what we're going to do is we're going to look at the first kind of classification, which is what is between the two bones. And it took me a long time to work this out in the literature, so I hope you appreciate it. All right. So we have three kind of varieties of joints. Just like when you go to the cafe, there are three types of coffee. First of all, we have a joint that's called a fibrous joint. Then there is a cartilaginous joint. Have a guess of what's between the two bones there. And there's also a synovial joint. So there are three varieties of joints that you can have. It's like a mocha or a dirty chai or a cappuccino. I love dirty chais. They're delicious. If you haven't tried one, I highly recommend it. Right. Fibrous joints. Between the bones, we have connective tissue. There's no hole present. There's no cavity. Okay? Now, we're going to look at three different kinds of fibrous joints. Look, the bones of your skull, between the joint there is a fibrous joint. Now, do you reckon that your skull bones move a lot? No, they do when you're a little baby, but remember, as Keaton taught us in the last lecture, After a while, these fuse and they do not move, like the skull is like a helmet for your brain. Let's have a look at this one. See, this one is called a suture. This one is called a different fancy name, okay? Can you see here that this one may move a little bit, but not a lot, okay? So that is a joint, a fibrous joint, a type of fibrous joint. And look at this one. There is also a joint, okay, holding your tooth to your bone, okay? This is an exception to the rule. So we have a bone there, and if anyone has gone to the dentist, you know how full of nerves your teeth are. Oh my God. Now, see the bone there? Here is the bone, here is the tooth, and here is the joint, periodontal ligament. Now, do your teeth move around? No, and it would be creepy if they did. They are stuck in there, so that one's not going to move a lot. So, we can start working on our concept map, all right? We have 3 different joint structures. This one has connective tissue between the bones. There are 3 main types and they all have different names. The ones in your skull are immovable. These ones move a little bit, and the ones on your teeth, immovable. Okay, immovable, because your teeth don't move around. Unless, of course, you're going from your baby teeth to your adult teeth. Normally, they don't move around. Okay, let's look at this second category of joints. This type of joint has cartilage in between the bones. Okay, what type of tissue is cartilage? It's connective tissue because it has cells in the matrix. There is no cavity, and there's a couple of types of cartilaginous joints. I like that word, cartilaginous. I feel very smart when I say it, cartilaginous. Let's have a look. Look at this one. Yeah, that is cartilaginous joint. Look at that one. The joint between the rib and the sternum. That one doesn't move very much. That one doesn't move very much. What about this one? Yeah, look at that. Okay, so we have some of them that don't move, like immovable, and these ones move a little bit. Okay, so a little bit. Okay, I'll let you fill in this concept map. Remember, we're looking at the bottom row, looks at how much they move. And you have 3 options. You have immovable, slightly movable, and the last option is freely movable. They are the 3 different terms that we use to describe them. Now let's look at the synovial joint. Now, most joints of the body fall into this particular structural category. And this type of joint does have a cavity. It has a hole. Now, there are 6 types of synovial joints, but all we're going to do for you guys now is show you the basic synovial joint, and you need to understand that because all the other ones are kind of variations of this. Let's move me out of the way, hey? There we go. Let's see what is in this synovial joint, the general structure. Now, I tried to find a picture that was really, really easy to understand. First of all, look at this. We have some really nice cartilage. So here's your bone. Here is your cartilage there. You may want to colour that in a different colour maybe. Oh, that arrow should be pointing there. Can you fix that for me on your notes? There you go. That arrow, this arrow should be pointing here. Can you fix it for me on your notes? Okay. That is cartilage. Now, as you know, this is absorbs, okay, compression and allows for quite nice movement. You don't want bone on bone. Ouch, that would hurt. And B, it would actually cause damage to the bone tissue. So you have to have a layer of cartilage. Let's see what else is in there. Synovial cavity. So this is the hole. This is the synovial cavity. Now in here, there's a space, right? And the space is called the cavity. Now in that space, we have something called synovial fluid. Okay? Now, if you have something wrong with, you have an accident or something and you puncture this fluid can actually come out. Okay? Yeah, so just be mindful of that. Now, the cavity is enclosed by a two-layered membrane. So here we go. Let's have a look at that. We've got an outside layer, which is made up of connective tissue, which is this green stuff here. And then you've got the inner layer, which is this blue stuff here. Now, the blue stuff is called the synovial membrane, and that actually makes the fluid. So that's quite handy, hey, to have it there. So the green stuff is protection, the blue membrane is fluid. Right, so where do we get the fluid from? Well, it actually comes from your blood, okay? So capillaries go in there and then, this membrane makes the fluid. It comes from the blood. Now, it's got like an egg white consistency, okay? Now, the whole point of exercise, I'm a terrible person when it comes to exercise. I'm completely not athletic at all. But you will notice that as you get older, the more you use your joints, the easier they are to move. So when you move this joint, if you move it a lot, this fluid becomes less sticky. Okay, so the more you use it, the easier it is to use. So if again, like I'm telling you all this time, if you've learned anything from me in 165 and 175, is you either use it or you lose it, okay? Right, so let's have a look and see what else we have there. There are some ligaments, okay? Now, I don't think they're shown. Oh, where's the ligament? Here it is, the ligament. Oh, back to front. Can you see there how that kind of holds everything together? Now, if someone says that they're double jointed, it doesn't mean that they have more joints. It just means that the capsule in their joints and their ligaments are much more stretchy, so they can move around a bit better, a bit more than other people, okay? So this is the ligament there, just helping us hold things together. Remember, the ligament is something that holds bone to bone, and that's the orange thing here. Okay, now, as you can see, synovial joints have neurons, okay? So there are sensory neurons in there, but most, and there's also sensory neurons in everywhere, really. There are sensory neurons everywhere. There are extra things, so some synovial joints have extra added features, okay, depending on what joint you're looking at. This is just the knee. So let's have a look and see what added features the knee has. For example, it has fatty pads. Let's see if we can find a fatty pad. There it is. Yeah, for extra cushioning. Not all synovial joints have that, but the knees do. And we also have some extra cartilage. So that's what your meniscus is. Yeah. So look, some extra cartilage. See, look, lateral meniscus, extra wedges. So it's kind of helping us out. So if you know that someone does their meniscus in their knee, you know exactly what they're talking about now because of this picture. all right? So just be aware of the fact that not all synovial joints are the same, but they do have the basic structure, but some of them have extra add-on features. Right, you may see sometimes people talking about their bursae and their tendon sheets, because some people have problems with those as an injury. Now, I just thought I'd let you know what they are. They are essentially extra kind of lubrication. Okay, so let's have a look and see. A bursa is a sac containing synovial fluid. Let's see if we can see. Look, there's one there. There's a bursa. And there's a bursa there. So it just gives an extra kind of structure. And a tendon sheath, if I can get my words out, a tendon sheath is an elongated bursa that wraps around a tendon. Okay, so just for your own knowledge there, sometimes people have bursitis. Okay, so now you know what that means because you've actually done this subject. All right, now, synovial joints, they have a cavity, okay, between the bones. It's a sphere between the bones. There is space in there filled with fluid. There are 6 types, but you only need to know the one here. Now the joint, that the type of synovial joint for the knee is called a hinge joint, okay? And these synovial joints are freely movable, okay? Freely movable. Okay. Now, let's have a look at some movements that are allowed by synovial joints. So just a few movements to kind of get our head around what it all is. So flexion is a type of movement. Now, what you need to understand here is that you're decreasing the angle of the joint. All right, so here we have the arm. It's at, 180 degrees. If it's flat, you're decreasing the angle. So you're moving from 180 degrees to, say, whatever, like 40, 90 or whatever. Okay? So that's the whole point. You are decreasing the angle. So here we have the leg, and here is the joint. So you're decreasing the angle of the joint. Extension is the opposite. This way, you are increasing the angle of the joint. So if you had your arm here at, 80 degrees, you would go down to 180. So you're increasing the angle between the articulating bones. So bone 1 and bone 2, and you look at the different angles. If you're going beyond that, it's called hyperextension. So that's beyond the anatomical position. So remember the anatomical position that we learned about in 165. So if you go beyond that, it's hyperextension. And rotation is when you turn a bone along its axis, okay? There are only certain parts of the body that you can actually do this, okay? And there are some examples there, okay? Now, for example, you can do that with your head and you can do that with your arms and your legs, but, there's some parts of your body where you cannot rotate them. All right, so I hope you enjoyed learning about articulations.